Most people think cardiovascular disease is only about plaque buildup, but many heart attacks and strokes become immediately dangerous when a clot forms on top of an inflamed or damaged blood vessel. To understand why that happens, you need to understand fibrin. Fibrinogen is a protein made by the liver that circulates in your blood. Think of it as rolled-up building material. When the body detects injury, clotting signals activate an enzyme called thrombin, which converts fibrinogen into fibrin. Fibrin forms long strands that weave into a mesh and stabilize a clot. That process is essential if you're bleeding. The problem is when the body becomes too prone to forming or maintaining clots inside vessels. Elevated fibrinogen matters because it usually reflects a more inflammatory, clot-prone environment. It's an acute phase reactant, meaning the liver increases production during inflammation, infection, smoking exposure, metabolic dysfunction, and other forms of stress. Insulin resistance, poor sleep, chronic stress, smoking, heavy alcohol use, and severe infections can all contribute. COVID became especially notable because many hospitalized patients showed unusually high clotting activity and elevated fibrinogen.
Picture arterial plaque as fat slowly clogging a pipe, but that's only part of the story. Plaque develops inside the artery wall, beneath the thin inner lining called the endothelium. And when heart attacks or many strokes happen, the immediate danger is often a fibrin-rich clot forming on top of unstable plaque. That distinction matters. Plaque is a slow process that develops over decades. Clotting is fast, and fibrin is central to that fast phase. Fibrin starts as fibrinogen, a protein made mainly in the liver and carried through the bloodstream. When your body detects injury, fibrinogen converts into fibrin, forming a mesh that traps platelets and stabilizes clots. Without it, even small injuries could become dangerous, so fibrin itself is not the enemy. The issue is balance. Too much inflammatory signaling, too much clotting tendency, or poor clot breakdown. One useful way to think about this is with two jobs. Job 1 is reducing excess fibrin production and inflammatory signaling. Job 2 is supporting healthy fibrinolysis, the body's clot-clearing system. The key enzyme is plasmin, which breaks down fibrin after a clot has served its purpose. Recent thrombosis research has found that some people form denser fibrin networks that are harder to break down, especially with aging and metabolic disease.
But clotting risk is not just about how much fibrin forms. It's also about how effectively the body clears fibrin afterward. The key enzyme there is plasmin, which breaks down fibrin meshes. Aging changes this equation. Research suggests fibrin networks become denser and more resistant to breakdown over time, even when standard clotting labs look normal. Lifestyle changes can shift this biology gradually. Whole food, high-fiber eating patterns, regular moderate exercise, consistent hydration, and omega-3 rich fish are all associated with lower fibrinogen and better vascular health. Garlic may modestly reduce platelet stickiness, but it's a small effect compared with smoking cessation and metabolic health. Fibrinogen can improve within weeks, while plaque changes take much longer.
That brings up systemic enzymes like nattokinase, serrapeptase, and lumbrokinase. These supplements are often marketed aggressively online, but the evidence needs careful framing. Nattokinase is the most studied. Small human trials have shown modest reductions in fibrinogen and some coagulation markers. Lumbrokinase has been studied in stroke and thrombosis settings, mainly in Asian cardiovascular medicine, with some encouraging findings. Serrapeptase has much more inconsistent evidence, including recent trials showing no meaningful benefit in certain fibrosis conditions. None of this means these supplements dissolve decades of plaque or replace medical treatment. Evidence quality varies, and bleeding risk matters, especially for anyone taking anticoagulants, aspirin, or other blood-thinning medications. The bigger point is that cardiovascular risk is not just about cholesterol alone. Inflammation, clotting balance, metabolic health, sleep, movement, and vascular biology all interact together. This video is for educational purposes only and does not diagnose, treat, prevent, or cure any disease. Talk with a licensed healthcare professional before making changes to supplements, diet, or exercise, especially if you have cardiovascular disease or take blood-thinning medication. And if you want more evidence-based breakdowns that separate hype from what the research actually shows, like the video and subscribe for more.